Medical nanotechnology script, nanoparticles in drug delivery for inflammatory bowel disease. Introduction. Medical nanotechnology has emerged as a revolutionary field that harnesses the power of nanoparticles for targeted drug delivery. Inflammatory bowel disease, IBD, which primarily includes Crohn's disease and ulcerative colitis, afflicts millions of people worldwide. The complex nature of IBD necessitates advanced therapeutic strategies that can specifically target the inflamed gastrointestinal tissues while minimizing systemic side effects. This script will explore the role of nanoparticles in drug delivery for IBD and various nanomedicine approaches developed for its treatment. Nanoparticles have gained significant attention as carriers for drug delivery due to their unique properties. One of the key advantages lies in their size, which allows for effective delivery across cellular barriers, including the intestinal epithelium. Moreover, nanoparticles can be engineered to encapsulate therapeutic agents, protecting them from degradation and enhancing their stability. This enables sustained release, ensuring a prolonged therapeutic effect within the target site. Various nanoparticle-based formulations, including polymeric nanoparticles, lipid-based nanoparticles, and inorganic nanoparticles, have shown promise in delivering anti-inflammatory drugs to inflamed bowel tissues. To enhance the targeting efficiency of nanoparticles, surface modification strategies have been employed. Surface modifications, such as the conjugation of ligands or antibodies, enable nanoparticles to specifically recognize and bind to inflammatory markers expressed on the surface of inflamed tissues in the gastrointestinal tract. By functionalizing nanoparticles with targeting moieties, drug delivery can be directed specifically to the affected areas, minimizing off-target effects. Additionally, surface modifications can influence the pharmacokinetics, cellular uptake, and biodistribution of nanoparticles, further optimizing their therapeutic potential for IBD treatment. Local drug delivery systems have been developed using nanomedicine approaches to maximize the therapeutic efficacy while minimizing systemic exposure. pH-responsive nanoparticles can be designed to release their cargo in response to the acidic environment of inflamed tissues. This approach ensures the delivery of drugs precisely at the site of action, reducing the need for higher systemic doses. Furthermore, stimuli-responsive nanocarriers, such as temperature-responsive nanoparticles, can release drugs upon exposure to elevated temperatures commonly found at inflammatory sites. Through these nanomedicine approaches, targeted drug delivery to the inflamed regions of the gastrointestinal tract can be achieved, enhancing treatment outcomes for patients with IBD. Controlled drug release systems play a crucial role in optimizing therapeutic outcomes for IBD. Nanoparticles can be engineered to release drugs in a controlled and sustained manner, ensuring a more constant drug concentration at the target site. This approach reduces potential dose-dependent side effects and improves patient compliance. Various mechanisms have been employed to achieve controlled drug release, including diffusion-controlled release, degradation-controlled release, and external stimuli-triggered release. By tailoring the physicochemical properties of nanoparticles, researchers can achieve precise control over drug release kinetics and achieve therapeutic concentrations that align with the specific needs of IBD patients. The gastrointestinal epithelial barrier serves as a challenge for effective nanoparticle delivery to the inflamed mucosal tissues in IBD. To overcome this hurdle, strategies have been developed to enhance the mucosal barrier penetration of nanoparticles. Surface modifications with mucoadhesive polymers increase the residence time of nanoparticles at the mucosal surface, facilitating their uptake. Nanoemulsions and nanogels have shown promise in improving nanoparticle penetration through the mucus layer while maintaining stability. Additionally, the incorporation of penetration enhancers, such as chitosan and surfactants, can further improve the transport of nanoparticles across the mucosal barrier. These approaches collectively contribute to enhanced nanoparticle delivery and improve therapeutic outcomes in IBD. In addition to drug delivery, nanotechnology has revolutionized the field of imaging and diagnostics for IBD. Nanoparticles can be engineered with contrast agents, such as fluorescent dyes or magnetic nanoparticles, to enable non-invasive imaging of inflamed gastrointestinal tissues. This facilitates accurate diagnosis, disease staging, and monitoring of treatment response in IBD patients. Nanosensors and biosensors have also been developed to detect specific biomarkers associated with IBD, enabling early detection and personalized treatment strategies. Through nanotechnology-enabled imaging and diagnostics, healthcare professionals can make informed treatment decisions and tailor therapy for optimal patient outcomes. Apart from drug delivery, nanomaterials themselves possess inherent anti-inflammatory properties that can benefit IBD treatment. Nanoparticles can mimic the functions of endogenous anti-inflammatory molecules, such as nanoparticles coated with anti-inflammatory peptides or proteins. This approach offers a novel therapeutic strategy for IBD, aiming to restore the disrupted immune balance in the inflamed gastrointestinal tract. Nanoparticles can also serve as carriers for anti-inflammatory agents, enhancing their targeted delivery and therapeutic efficacy. By utilizing nanomaterial-based anti-inflammatory therapeutics, researchers seek to mitigate the chronic inflammation characteristic of IBD and improve patients' quality of life. The immune system plays a pivotal role in IBD pathogenesis. Nanotechnology offers unique tools for immunomodulation, enabling researchers to manipulate the immune response to attenuate inflammation in the gastrointestinal tract. Nanoparticles can be engineered to selectively target immune cells, delivering immunomodulatory agents directly to the affected tissues. Additionally, nanotechnology enables the development of vaccines against IBD by incorporating specific antigens into nanocarriers, enhancing their immunogenicity. The precise control over immunomodulation offered by nanotechnology holds promising potential for developing more effective therapies that regulate the immune system and alleviate the symptoms of IBD. Nanotheranostics, which merge therapeutic and diagnostic functionalities, enable personalized treatment approaches in IBD. Nanoparticles can be engineered to simultaneously deliver therapeutics and serve as imaging agents for real-time monitoring. By incorporating both drug delivery and diagnostic capabilities into a single nanosystem, clinicians can monitor treatment response, adjust therapy if needed, and optimize patient care. This personalized approach facilitated by nanotheranostics holds substantial potential for improving treatment outcomes and patient management in IBD. Tissue regeneration is a crucial aspect of IBD treatment, aiming to restore the damaged gastrointestinal tissues. Bioengineered nanoscaffolds offer an innovative approach for tissue regeneration by providing a three-dimensional, 3D, structure that supports cell growth and facilitates tissue repair. These nanoscaffolds can be functionalized with growth factors, cytokines, and other bioactive molecules to enhance tissue regeneration and promote healing. The use of nanoscaffolds provides a biomimetic environment that closely resembles the natural extracellular matrix, facilitating cell adhesion, proliferation, and differentiation. Bioengineered nanoscaffolds hold immense potential in promoting tissue regeneration and improving the long-term outcomes for IBD patients. Oral drug delivery is highly desired in IBD treatment to improve patient compliance and reduce invasiveness. Nanomedicine offers innovative strategies to enhance oral drug delivery efficiency. Nanoparticles can protect drug molecules from degradation and improve their absorption by promoting mucoadhesion and cellular uptake. Moreover, pH-responsive nanoparticles can release drugs specifically in the inflamed regions of the gastrointestinal tract, enhancing their therapeutic efficacy. Nanoparticle-based oral drug delivery systems have the potential to revolutionize IBD treatment, providing targeted and efficient drug delivery while minimizing side effects. The safety of nanotherapies is of paramount importance. Nanotoxicology focuses on studying the potential adverse effects of nanoparticles on living organisms. Concerns arise regarding the biodistribution, accumulation, and long-term toxicity of nanoparticles used in IBD treatment. Extensive research efforts are directed towards understanding the biocompatibility, immunogenicity, and clearance mechanisms of nanoparticles. Nanotoxicology studies provide invaluable insights to guide the design and development of safe nanotherapies for IBD patients. By meticulously assessing the potential risks associated with nanotherapies, healthcare professionals can ensure the safe and effective use of nanoparticles for IBD treatment. In conclusion, the field of medical nanotechnology offers a multitude of opportunities for the targeted and personalized treatment of inflammatory bowel disease. Nanoparticles provide unique capabilities for drug delivery, imaging, and immunomodulation, facilitating precise and efficient therapeutic interventions. By harnessing the power of nanotechnology, researchers can develop innovative nanomedicine approaches to address the challenges associated with IBD treatment. Further advancements in nanotechnology and nanotoxicology will undoubtedly contribute to improved outcomes, enhanced patient care, and ultimately, a better quality of life for individuals affected by inflammatory bowel disease.